All right. Today we have on a very, very special guest, Cassandra. She is the owner of Hakuna Matata Mamas. She is an L&D nurse. She is also a doula, and I don't want to butcher the introduction. So, Cassandra, why don't you give us a little bit about yourself? What do you do? Who are you? And what makes you the awesome L&D nurse slash birth worker slash doula that you are?
Thank you so much. I'm so excited to have this conversation with you. I, as you said, started Hakuna Matata Mamas after 13 years of being a high-risk labor and delivery nurse because I saw way too many women experience traumatic births within the hospital. And I really, truly felt like in that moment at the bedside, it was the wrong time for me to try and start educating women or helping them advocate for themselves because it just felt like it was putting way more pressure on them. And they were like, I can't even think about that right now. Like, or they'll say, I didn't even know that was an option. So like, and they didn't have enough time to process it. And as you know, in labor, in the moment of things is not when you want to be thinking about those types of things. It can truly just throw off your whole labor. Um, so yeah, I started Hakuna Matata Mamas, and I ideally love to have women in their first trimester, but I work with women at all stages of pregnancy, just truly working on the mindset portion of it and working on coping mechanisms because um, the trauma, I try to prevent the trauma. So just learning on like how to trust your body and lean into your intuition and work on coping mechanisms and the mindset stuff. It's not just like toxic positivity either. There's a lot more that goes into it. I think people correlate it with hypnobirthing in a sense, but not as like deep as that. I think this is more just like really focusing on the nervous system. So I do a lot of that work. But yeah, that's a little bit about me.
I love that so much. That is something I think that is desperately needed on this channel in particular, because most people who follow me or who download the Primal Pregnancy app do so because they want the hacks. And those work. They are evidence-based. I have used them myself. People I know have used them. They work, but the foundation has to be that your nervous system is in a state of homeostasis. You have to be calm in order for everything else to work. Otherwise, you're just like drinking baking soda, doing the acupressure, but you're like hyperventilating. It doesn't work. It doesn't work. So Cassandra is here to talk to us about the foundation of everything, which is the nervous system and staying calm and, even in a high risk situation, which is very difficult to do. When I had my own high risk transfer, I was a crunchy mom who was planning an out of hospital birth, and then at 35 weeks pregnant, I had to get transferred to a hospital. Everything that I did not want, everything that was not in my birth plan. And you are the nurse I wish I had, because you're not an average L&D nurse. You are also a friend and an advocate of high risk mothers like I was. So what sets you apart in this regard? You mentioned that you saw some pretty troubling things. Could you go into that a little bit more?
Yeah, I what sets me apart, I think, is that I have been traveling for the last 6 years. And when I worked at my like home base hospital, I had a 7 years of level one trauma. And truly, that hospital, we worked with women who had very high risk pregnancies and babies with myelomeningocele, or omphalocele or gastroschisis. So like it is, there were a lot of different anomalies or things that you would not see in a typical, like a lot of women got sent to us, like flown to us for high risk things. So that was kind of like in that facility, I got so monotonized. It was like, okay, you get into this process, you admit them, you start the IV, you do this, you do that, and like it was really, I wanted more. I knew that I wanted, like, I got a little bit burnt out after 5 years. And I went back to become a midwife. And I knew that that wasn't for me with like the work life balance of things. And I then found out about travel nursing. And then I started travel nursing. And when I started travel nursing, I got to work with so many different providers. And I was like, wow, there isn't just one way to do it. And I think that it's so easy for providers to, and we clock in and we clock out, and like there's just a difference between nurses who actually like enjoy their job, and I think you can tell in labor and delivery. I've had so many patients say to me like, you can tell you love this and like you're so passionate about it. um so yeah, I think the passion just stems from like, I mean, I've always known I wanted to do labor and delivery. Again, more on the crunchy side of things, the holistic, the midwifery. Like I am pro natural birth. And I do think you can have a beautiful natural birth in the hospital. You just have to be prepared, and, know how to advocate for yourself. But yeah, so I mean, without going into like, traumatic birth situations, I think the hardest thing is witnessing obstetric violence. And that like is my passion for that, and trauma informed care. So truly seeing the woman in the bed as a human, like she's not just a patient. And again, not just a medical, like a complex medical situation. She also has probably exterior things happening, and does she have somebody at the bedside, and like what is her home life like, and what is she showing up here with today. Like I think it's so important to look at the whole picture, not just a 39-week pregnant woman, gravida 2, para 1, with gestational diabetes and hypertension with an encaphalocele, or like, whatever, all the things. It's like, yes, that's part of it. But I also want to make sure that like her nervous system is okay and she's feeling safe and she's feeling seen and heard, and, going into all of that.
Yeah, yeah, absolutely. And I will also add that that is such an underserved population, the crunchy mom who ends up in a high risk situation. That was
Mhm.
me and I hated it. And as much as I loved my midwives, and they called to check in on me, but it was very much, you are not in our care anymore. Sucks for you. Good luck.
Yeah,
And they didn't say that, right? But there, that
totally.
was just out of their practice, and there was nothing they could do. I mean, they couldn't even come into the hospital to check on me when I was going through what I was going through. um I mean, so I'm just so glad that you are there for those women like me. I mean, I have such a heart for them because I was there too. I'm so glad that you're doing that. Okay, you mentioned that you always wanted to be in labor and delivery, which I don't hear a lot. A lot of women, I feel like, enter this space because they
Mhm.
had an experience of their own. So what in your career or maybe in your life led to that strong passion for this work?
Yeah. When I was 16, I went to this little clinic in the neighborhood, because my friends had gone there and got their birth control, and I hadn't got my period yet. So I was concerned that I was like a late bloomer or something. I don't know. I was like ashamed to tell my mom, like, hey, how come I haven't gotten my period? So I went there, and I just felt so safe and like seen. And it was a clinic of midwives who just did like birth control and, gave away condoms. And like, it was just a cute little, like, I don't know, a little hippy dippy.
Mhm.
It was a great place. And I just really connected with that. And then my sister had a baby when I was 17, and I got to be in the room, and her midwife let me like put on gloves and play midwife kind of, like I didn't get to
Mhm.
like catch the baby obviously, but she was like, come in here and let me be in there as like a little med student kind of, which it was just, I felt like, I don't know, it changed my life. And I, again, the midwives was like, I just always had that. So I was like, oh, I love, and I connect with women on a different level. I think I can see a woman as like a whole. And all my friends say that like I have a way of connecting with people, which is a really good thing. I just feel like I am a good listener, and I like to hear other people's stories and see other people. So yeah, I don't know. I think it was just my calling, and I feel very at home and like I'm where I belong.
I love that. And I'm going to also add this little just personal comment. Your content, it is very just what you put out on Instagram and just your vibe. It is very clear what your opinions are, what your stance is on a lot of things, but you are so generous to the other side. And there's no judgment in your tone. You're just sharing what you think, and but there's always another, and I just love that. And I'm sure that that comes across not just in your content, but as a birth worker as well. And that, I mean, that's just everything that women need. Um, so for our moms, most of the moms watching are not planning a hospital birth.
Mhm.
And I hope that they don't have to have one, but everybody needs an emergency transfer plan. So what would you tell to our moms who don't want to have to see you in the hospital, but if they do, how should they be preparing mentally, physically, all the leaves?
Yeah.
What should they be doing um, for that emergency transfer plan?
I honestly think that like you in your the work that you do, you're already preparing them mentally. It's the the most important thing is to not go into that like defensive mode right away. I think so many people are because of fear, right? We go into that I'm going to protect myself. So I'm going to feel like I have to be defensive or like, oh, I don't want that. And then, you're thinking in your head, or again, social media. I shouldn't say again, I haven't said this yet, but like social, you touched on it a little bit, how like I do try really hard to see the other side of it. But social media gives this such like negative connotation about the hospital. And don't get me wrong. Yes, I have been there. I've seen it. But the worst thing you can do is feel like you have to like speak for yourself or like talk, you know what I mean? Like as a home birth, and I've seen so many home birth transfers. So as a home birth transfer, the women who are like, they're almost angry and upset and frustrated. And it's like, to be able to take that mindset and like, it's okay to have those feelings. I'm not telling you not to have them, but to remember you're in a very vulnerable state, and anything you tell yourself, your body's going to listen to it, and that is the number one thing. Trying to stay in a regulated state instead of like, oh, I failed, I'm being taken to the hospital, or oh, I'm going to have a C-section because I'm going to the hospital. Like these are not good thought processes. And yes, the fear and the anger and all of those feelings can live over here, and you can also have hope and still have this like joy of I am meeting my baby no matter what, no matter how it happens. I'm going to meet my baby and I get to choose how I'm feeling right now. And you have the power. Like in any situation, you have the power. You can decide if you want this fear and this anger and this anxiety and resentment and what all of these negative feelings over here be more powerful than these like happy, joyous, exciting feelings. And that's where like again, the mindset and learning how to cope and being able to have that brain power to shift your thoughts and be like, okay, I hear that. Yeah, but I'm not going to let you take over right now. And in the moment of being in labor, it's very hard to do because you're like, there's so many things happening and hormones and surges and like, transition and whatever point it is that you're being transferred, it is like, it's hard to navigate all of those things. So then that's the most, and again, I do think that you do a lot of that work ahead of time. Practice the mindset stuff, and then try not to be defensive from I'm stepping into my nurse role now, like of when women come in and they're like, they're so like, I don't want that. I just, and if we're telling you from like a good, I mean, I don't know. I think it's hard to go into that. Like, oh, they're telling me that I have to have that, but I don't believe it. Just like ask questions, ask questions, please ask questions. Like, and not only you, your support person, because your support person is going to be better at it. However, your voice is always louder than anybody else's in the room. Like women who have doulas or their partners speak up for them. Like, yes, but the provider is going to listen to you and want to hear what you have to say, which is hard because in birth, of course, in labor, you're like, I don't want to talk right now. But I think just not, yes, I want you to have your voice. So I want you to advocate for yourself, but the being defensive and advocating for yourself are two different things. So that's my word of advice.
Okay. Could you give an example of how saying no would look without the defensiveness?
I would say, can you explain why I need to have that, or why can I'm not understanding why you're recommending that. I want to know more about it. Again, going into the brain acronym, right? Like risks and benefits. And it's not even, you don't have to necessarily just say like, I don't feel that right now, or and again, I think so often we go into that like, oh, I just want a healthy baby, healthy mom situation. I think leaning into your intuition and truly being like, and say like, that just doesn't feel right to me. I'm having a hard time understanding why you want me to do that. So truly it's all about communication and how you're communicating. Like, yeah. So does that answer it? Sorry.
No, yeah, 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 it does. Very well. I love that brain acronym. It's so simple, and I feel like, at least for me, because it's so simple, I almost forget about it as such
Yeah.
the effective
Mhm.
tool that it is. But no, really. Um, so I'm going a little bit off script here, but I would love to turn our attention to the dads or the birth partners, whoever's there with mom.
Mhm.
I say dad just because that was who is there with me. Um, what what do you have to say for them? Because my husband, he prepared so well for our daughter's birth, the Bradley course, and we met with the doula and all the things, and he nearly fainted when I gave birth, because it was just so overwhelming, and he just wasn't like. I mean, you see the videos, but then you're actually there and it's your wife and that's your baby and it's just completely different. So what do you have to share for our birth partners?
Yeah, they're honestly, it's so frustrating that I think they're the forgotten ones. And it's not just the birth partners, it's the mom and the sister also in the room. Like I always make a point to look at them and see them also, because they're the ones that are actually like the mom, the woman in the bed giving birth is like going to listen to these people. I mean, again, there are times where I've had a woman look at me and be like, tell me what to do. And they're not even listening to their partners. But I do think that like that relationship is so important. So seeing them. So I think truly just be present. Like the the people who are on the in the corner on their phones is really, really like frustrating for me. And I'm sure even more so the woman in the bed. So hands down, like try to be present. It truly is a short time. I get it. Sometimes it's 3 days and, maybe even a little bit longer, but like it is so important to just be present and try to help, assist, like, be there. And some people feel really uncomfortable. And I think that that's just because they haven't done that work. So the passing out part is probably because he hadn't eaten anything, or like, had maybe a low blood sugar too.
It
Like
was 5
it
a.m.
again is a long time. So I definitely say to like, eat snacks as well. Don't like a lot of times people are like, oh, I can't eat because she's not eating. Or like, no, you have to eat. Like, I can't tell you how many times I look at the dad. I'm like, you need to go eat something. It's okay. You're not going to miss the birth. Now, of course, sometimes it does happen, but it's like so rare. So it's more important for you to eat something than to pass out and miss the birth anyway, right? Like, so take care of yourself, drink water, ask for juice, ask for the things that you need, because your voice matters too. And your support, like you have a job there to be supportive. So um, I just cannot fathom or like cannot stress enough that like after you are supportive and through that, like your relationship as a couple and like you going as a woman, you going through something really hard and your support person, whoever it may be, so truly supporting you and being there for you. Like I cannot tell you how many women have looked me in the eyes and been like, oh my God, I couldn't have done it without you. And I know that women are saying that to their partners too, because it is just such a vulnerable, that feeling of like, oh my gosh, I can't, I'm so alone. And to like look into your partner's eyes and like know that they're truly there for you. So like just be present. Circling back, full circle moment here, just be present, I think is like the best thing. So many women are like, get off your phones, stop doing that. We don't need to watch TV. Like, and yes, there are times where it's okay and appropriate, but like in active labor and like, when things are happening, I think it's so important to remember to be present and see her and try to think about what would comfort her. Hopefully you're talking about this beforehand, but yeah, so I work very closely with the partners because I am virtual. So I do a lot of partner work, and I think that it's, again, so, so important that they understand what's happening, because I've seen, again, so many partners who are like, oh my gosh, she's in pain. She needs something. And it's like, no, she wants this right now. And like, it's not pain. It is like she's working towards something. Like, if your partner was running a marathon and she looked uncomfortable, you wouldn't be like, oh, give her some drugs. She looks uncomfortable. You're going to cheer her on and say, get to the freaking finish line. So let's do that here in this situation too. So I work heavily on the partners understanding that like this is a different, like it's not necessarily pain, and yes, it's discomfort, but if the woman is choosing that, then that's their choice. So it's important for the partner to understand like what is actually going to happen, and yeah, what their role is. So yeah, I work a lot with partners, so I'm glad that you brought that up.
Yeah, yeah. No, I mean, it's just so important. I mean,
Mm-hmm.
you've seen the stats. A well educated, knowledgeable birth partner who is present for the mom. I mean, less cesareans, shorter labor, lower risk of interventions, less pain perception. I mean, there's not a doctor or an intervention on this earth whose mere presence can do so much for a
Mm-hmm.
woman's labor. But that's the dads, that's the best friends, that's the sisters,
Mm-hmm.
the person who makes that mother feel safe. And I mean, it's just such an important role. I like to say that besides the mother and the baby in her womb, the dad is the most important, or
Mm-hmm.
whoever the birth partner is the
Yeah.
most important
Mm-hmm.
person in that room. I mean, I want to tell them how important they are, how important their role is. So I would love to ask you a question for the moms who are in a very difficult situation right now. For the crunchy mom who is facing a transfer or an unwanted diagnosis, what do you have to say to her? What should she be doing right now to mentally, physically, whatever, prepare for
Mm-hmm.
whatever's about to come?
Mm-hmm. This is my ideal um, client. I don't know what to say. My ideal woman, uh, who I would love to work with, because I take that like crunchy mom who wanted a birth center birth or a home birth, and all of a sudden found out from their midwife that they can no longer be seen by the midwives. They have to be transferred to the hospital, because that feeling is like immediate shame, grief, disbelief. Like, I mean, the emotional overwhelm is intense. And then after that sets in the anxiety of all of the things. Like, again, trusting the hospital, the facility that you're at, and the providers that you're transferred to, is so important. So I balance, like, I take a bridge from like your emotional unrest and try to not make you, help you understand, what it is that your providers are trying to do for you, or help you understand the situation, and remind you and help you still maintain your voice and your power. I think there are a lot of women who are like, oh, I have to do exactly what the doctor says because I want a healthy baby and I want to live. But I'm here to tell you that you still get a voice. It's so important to still feel heard and feel comfortable and confident and courageous in this moment. This is literally a changing point for the rest of your life. And this will affect how postpartum happens, your bond between you and your baby, and your mothering from there on. Like, do you have postpartum depression? Can you bond with your baby? How is feeding going? All of those things are truly affected. And again, your baby's nervous system. Like, I cannot stress enough, if your nervous system is unregulated during pregnancy, it's affecting your baby. And that's that's biology. Like it's truly, that is, it's physiology. It's what's happening inside of us affects us more than we ever think about, right? We're just thinking about healthy baby in the sense of like it doesn't have any anomalies or like it has 10 fingers and 10 toes, right? Like, no, there's so much more than that. It's deeper than that. So I help you when you get that diagnosis, go into trusting your intuition. Like you have got to listen to that. You know better than the provider, always. Like they know the textbook, they know the, and truly sometimes I challenge providers and I say like, did you ask the patient or are you just going off of like what the labor curve is supposed to be? Or you know what I, it's so crazy. Sometimes you're like, did you even touch the patient? Like, did you see her? You know, like, no, I just went in there and asked her questions. I'm like, oh my gosh. So yeah, I see her and I want her to know that like she's not alone and her feelings are valid. And it is so important for you to have support because the scrolling, the doom scrolling is by far the worst thing you can do for yourself. Having an unregulated nervous system, dysregulated nervous system is detrimental, not only to you, again, your baby, right? Like in that moment, it is it's hard to get back. And then again, like building that trust with the system is important. So that's where my hope is like, I have a nurse background, but I also bring in this holistic crunchy, like seeing all of you and helping you understand, like, what did your doctor say? What did that mean to you? Were you able to speak up or did you feel like you couldn't speak up, you know? So
Well, I would love to ask you a little bit more about your doula package. It is unlike anything I've seen anywhere else, and it is so needed. I feel like half of birth workers should be focusing on something like this because it is so needed. So do you want to go into that a little bit about
yeah,
exactly
sure.
what you do for women as a doula?
Yeah. So I think I touched on it a little bit, but like I am all virtual. So I have four prenatal. I do an a la carte too, but this is like my main package. So I have four prenatal sessions and then on call for your birth and then one postpartum session. And I, again, focus really heavily on mindset. I do have another package that you can add on top of that where we do more deep mindset if you don't feel like you already have enough because I want to make sure that I'm meeting you where you're at. So some women come into my world and they're already like have done the mindset stuff and they feel like they have a good handle on that. And so then we just do like the typical prenatal stuff, or I add on a couple sessions and we do more deep of the mother mindset stuff. So, and then, like I said, I focus in the prenatals really heavily on creating a relationship with your partner because virtually, when I'm there for your birth or like, you know, available for your birth, they're going to be the ones that will be reaching out to me. So I want them to truly feel safe and like they can ask me anything and not feel, you know, scared or yeah, like not heard. So yeah, it's different. Like I said, it's virtual and it's like having your own labor nurse in your pocket. I also offer 24/7 tech support, which I think is something that every woman I've worked with always adds on because it is like, you know, they just text me random things like, oh, I just had this happen. Like my client right now, she's like, oh, I just had bloody nose. Like, is that normal? Like, it can be. You know, so truly just a support, like a 24/7 support line is super helpful. I think women feel seen and heard. And yeah, it prevents the doom scroll because the doom scroll is real and the spiral slide, like getting on that pregnancy spiral of like, oh my gosh, is that going to happen to me? I'm high risk. I'm automatically going to have a C-section or I'm automatically going to have an induction. And that is not true. Yeah. So yeah.
That is such a good reminder for everyone, but for me personally, 'cause I mean, 90% of what I do as a birth worker is just virtual, and it's a lot of content creation.
Mhm.
And unfortunately, the necessary evil of Instagram plays a large role in that. And
I know.
it
Girl.
I am still very much learning how to manage it instead of it managing me.
100%. I feel that. It's like the worst thing, but and again, it's like women are we all do it. And I'm not saying that like Instagram's terrible or that, you shouldn't do any of it. Yes, you can do some of it, but I'm talking about at like 3 a.m. when you can't pee. You just or can't go back to sleep. You just got up to pee. You can't go back to sleep. The worst thing you can do is jump on your phone and start scrolling, like, because the blue light, you even with the warm night on, like, it doesn't matter. And then you start that spiral, and then you can't sleep, and you're more anxious and alert and awake than you ever have been because you just saw something on the gram. So
Yeah.
we sometimes, I think, forget how much it affects us and our cortisol levels and, like, our nervous system and all the things. So
Yeah. Yeah. Because when you're constantly surrounded by it, that's just your baseline level of normal. I mean,
yeah. Mhm.
yeah, you forget. You really do. Um, one more time, I want to go off script and then we'll end in a minute here because I know my kids need me. But I would love to ask for the moms who have had a traumatic experience in the past and nothing is wrong with this current pregnancy. I hope you don't hear my little boy. He
You're
hears me
good.
talking. I know he's pitching a fit because he wants to come in. So for the mom who has had a traumatic experience and she is fine so far this pregnancy, but she has those concerns and I mean, she has a lot of reason to be stressed and nervous. She's been through trauma. What do you have to say to that mother?
um do the work now. I think so. I actually, one of my clients right now is grieving a very traumatic birth. And again, she's like getting close to delivery, and I think all of those feelings are coming up, and I cannot commend her enough because I see it. I've seen it at the bedside, as your nurse, and a lot of times women won't even like tell me why until after. They'll be like, "Oh, I was just so afraid of like the same thing happening as what happened before with my first." So, and it's not ever going to be completely healed. Like, so I say that very carefully. That birth trauma is a lifelong thing,
Don't
but
tell me that.
it's
Okay,
true.
okay, no, I want to hear
It
your take.
is.
This is important. Okay.
No, it's true. It is. And like their trauma is forever. Like we can't ever like say that I'm gonna be normal or back to normal. Like it's an imprint and it's in you forever. Like, but how you look at it and your approach to it is very different. And like, yes, that made me who I am today. And that is part of
Mm.
my story. And I am educated on what that could be, what that like I'm sorry, I feel really bad. I'm like still hanging on the fact that you said like don't say that. But I do
No, no, no,
feel
please.
like it is, I know that it's an imprint. It is never going to go away. It's just that like you look at it differently. And maybe it doesn't, you don't think about it every day, right? Eventually we're like, it doesn't affect us. But in birth, when you're going through a very similar situation, your body is automatically going to go into the fight or flight to protect you. Because you're automatically like trying to prepare yourself. So that's where it's so important to have the nervous system ready, of like that mindset reframe, being able to say like, okay, I have this fear, and fear is good. Like it is okay. It's not negative. I think we have to get over that. Like fear and anxiety and grief and, shame are all bad things. They're not bad. There's no bad feeling. It's a feeling. And acknowledging it is the best thing you can do. And then taking that feeling and being like, okay, but I'm like freaking happy. I get a second shot at this. I get to do it again. Like, and I'm aware now of this and how to try and prevent that. If I feel it happening, I can stop it, or I can ask questions, or I can prepare more, because a lot of the times it's like people who are not prepared, or people who don't understand that they can ask questions and feel like, oh, the doctor knows best, and don't trust your intuition. Like lean into your intuition. That will, your trauma is just going to protect you. Like you have to change that mindset of like, oh my gosh, that trauma really messed me up. And it does. I'm not saying it didn't, but it is like, work on that leading into it so you can acknowledge it. And that's where, again, the mindset stuff of like being able to listen to your intuition and your body and what is your nervous system telling you, and be able to acknowledge that and react, right? It's all about your reactions. And our reactions come from that nervous system instead of like an immediate reaction is like a you might not be listening to your gut, or it's so important to lean into that intuition.
Mhm.
Yeah. Sorry, I feel bad. I feel bad.
No, no, yeah, so the more I listen to what you had to say, I actually agree with you 100%. There is a vast difference between meaningless pain and meaningful suffering that became
Mm,
part of the story of who you are today. Um, and I think through healing and through time, you can turn that pain into the meaningful suffering that it should be.
totally.
So yeah, yeah, I know,
Mhm.
I love that. My mom,
Yeah.
she's a therapist. She says you can't control the first thought that enters your mind, but you can control your response.
100%. And that's your nervous system. That is truly like your gut reaction, that first like instinct. Acknowledge it. Be able to put words to it instead of just reacting, right? Like, oh, that didn't make me feel good. I don't know how I feel about that. Like, I don't know. I think it's just practice too. It's not just like, oh, I'm going to do this one thing beforehand and I'm going to have it all figured out. Like, it is practice. It takes a long time to do.
Yeah, yeah. Well, Cassandra, this has been therapeutic for me. I hope it helps somebody else as much as it's helped me selfishly. But before we go, where can moms find you?
Yeah. www.hakunamatata.mamas.com or on Instagram at Hakuna Matata Mamas. And I am on Friday going to, and I do this often, host the Real Birth Prep, which is not your average hospital birth course, but kind of like a crash course. And it's not about the labor curve or anything like that. It's just about, again, more like mindset stuff and like truly being prepared for the hospital if you do have to go to the hospital. And I offer free 20-minute clarity calls with anybody. So if there is a mom who did just, find out that she has to go to the hospital or has to transfer providers, I hands down will love to talk to you and help, figure out what's next for you.
And is that this Friday or is that
Yeah.
every Friday? Okay,
Yeah, no, just February 6th. I'm doing a pop-up one, but you can follow along and I'll be doing more. But yeah.
okay, okay. I was gonna say I was thinking about posting this a little bit later in the month, but we will
Oh
make
yeah,
sure
yeah, yeah.
we'll make
No,
sure
that's
that
okay.
no, no, no. I'll make sure that it will get
That
posted
makes
before then,
sense.
just in case there's anybody who needs
Yeah.
to attend that
No,
and
that's
needs to hear
okay.
this. We'll make sure it gets posted.
I do them
Okay.
often too. It's not just this Friday, but yeah, so
Okay.
that makes
Okay.
sense.
All right. Well, thank you so much. You have a
Yeah,
good night.
thanks. You too.